So at the end of the day, you're done with your work, you attended to your patients, and you come back home. What is that one question that comes to your mind?
What we really need to be careful is about labeling people, before we make a accurate diagnosis of what the diversity is.
In few cases, what we have is that it is inherited from the parents, where parents are asymptomatic and it is sort of hidden in them, and it is come out in the child because they have received those two altered gene from the parents which were hidden in them or masked in them. Because most of the teachers are probably not really trained, though they are supposed to, in picking up learning disorders well.
LD test আমি করি নেব, কিন্তু আগে ডিসিপ্লিন টেস্টটা কেন পড়াতে যাব? তাহলে তো অটিজমের টেস্ট যদি দেখতে হয় ইনক্লুশন ঠিক আছে, কিন্তু স্যার অটিজমটা বাদ দিয়ে বাকি টেস্টগুলো করুন।
Even I would say Bollywood, Hollywood, though there are wonderful movies that have come out, but they have very typecasted autism.
You cannot just counsel. You've got to do something for the motivational counseling.
All we are getting are people who are pseudo specialists. Then I'll name the school also over here, South Point, please. And what happened is, when this child lost ambulation, they did not have a ramp. This child was bullied so much that she actually came back saying, I don't want to work.
Welcome to Truth Forecast, where the mind is without fear. Today we are discussing Beyond Labels, understanding the spectrum of autism and learning disabilities. Joining us today is Dr. Dipanjana Datta, Dr. Shumi Ghosh, and Asimya Nandi. Could you tell us a bit about your work?
So I am a genetic counselor, and I am also in capacity as a state coordinator for Organization of Rare Disease India, as well as the scientific advisor for Rare Warriors of Bengal. And I normally see patients who are or families who might have a genetic diagnosis, and then we do some hand-holding for them.
Dr. Ghosh, could you tell us a bit about yourself?
I'm a consultant pediatrician who's been working in Kolkata since 1997. I've had a stint in the UK from 2005 to 2008. Pediatrics has been my passion ever since my house staffship days. And these 30-odd years of experience have led me to understanding, what's neurodiversity, which is the topic of discussion today, and trying to develop an approach which would make them an integral part of the children in the mainstream.
That is so lovely to hear. And joining us, as we said today, is Asimya Nandi. So could you tell us a bit about your work?
I am a pediatric neurodevelopmental therapist. I did my bachelor's and master's in physiotherapy with a pediatric experience, and then after that I just went to South Africa and completed my PhD also here. So my PhD is mostly based on was on movement disorder in neurodiverse, but still I'm learning. I am having experience of something around 20 years, but still learning.
So without much ado, I think we should begin with the topic at hand. So what would you say, what does neurodivergence mean to you?
Right. So, all of us as human beings, we are pretty unique. And supposing I were to open the window of a room, okay, what you perceive and what you see may be a lot different from what I perceive or what Oshiman perceives and sees. So the human mind is something which can interact with its environment, with what it's perceiving, what it is seeing, what it is thinking in different manners. So these differences in our perceptions with the mind that we have, that is what is defined as neurodiversity. It's a difference, it's not a disease. That is the message we would like to emphasize on.
What would you all say is the common misconceptions that surround something like autism? There is a widespread misconception regarding what autism is. How would you define that to a layman, let's say?
Autism, coming to that, misconceptions, there are many misconceptions. Autism is due to a bad parenting. So I would say it's a false. Autism is because of not giving the particular time to a child Like maybe the child has watched more of TV, so it's like, oh, it's on television, so oh no, so the main, you have missed that particular time. So I would say no, that is also false. But to be more distinct, and many misconceptions, like even like whenever a childhood is not able to speak, that means he is autism. So it's like there are misconceptions are there. But to be more in that, like how to bring it, like autism is something like they are different. But the thing is, like sir said, like every brain is having a different structure, and its working pattern are different. So I would say, like, it's when they are different, but the thing is, like, they have a uniqueness in them. So every child, every child with maybe neurotypical, as well as when you compare with the neurodiverse, so they are having their own levels, and that we need to find it out, and we need to give them a little bit support.
So, what is the common misconception that you have come across more?
So, Mekla, I think so. What we really need to be careful is about labeling people, before we make a accurate diagnosis of what the diversity is. They're not all intellectually disabled. That is one misconception which has a very loud and clear message should go across. If I were to exemplify and take names of people whom we all revere and respect, you would realize that all of them were within this spectrum. It can be Charles Darwin, it can be Isaac Newton, it could be Einstein, it could be Tansen. They all had special capabilities. So this misconception that they are intellectually disabled has to be removed.
Absolutely.
The other misconception, I think so, which we've come across, is that people tend to think that they do not have feelings. They lack empathy. So it isn't like that. I would love to have a friend. This person also would want his circle of friends. I could feel hurt by any other human action. This little one, if not respected, if not integrated into a family or into society, would also feel hurt. And the other misconception as a pediatrician, which we faced down the last few decades, is that vaccinations apparently have been playing a role. This theory has been completely debunked with whatever evidence that we have. And this is something which we really need to clear out from people's minds.
What would you say is the salient difference between autism and other learning disabilities?
So basically, when you're talking about autism, you're talking about a social difference in communication. I wouldn't even say it's a miscommunication, all right? There are some repetitive patterns in that behavior, and there are some sensory issues also as to how they react to a particular emotion or to a particular environment. Whereas when you talk about learning disorders, it's more academic about what you read, your ability to write, or your ability to juggle with numbers, that is your mathematical abilities. So there can be an overlap between the two, but yes, they are distinct entities. And as Oshiman would probably elaborate, the treatment also is different, right? So we cannot be treating a learning disability and an autism under a stereotypical treatment.
So you also deal with a lot of patients who come in with learning disabilities. How do you treat them differently in terms of treatment? How do you deal with them? And what is the way you deal with autistic patients? How is that?
Like every therapy has been like a different, in the, like suppose a learning disability, in which like we need to find out like which area or like the child is lacking. Particularly it's in the reading part, or it's the mathematical part, or it's the writing part. So all the 3Ds of the learning disability is a common term is dyslexia. So the dyslexia, so we need to find out which 3 parts are missing, like dyscalculia, is the it's done with the calculation. It's the maths part, dyspraxia and dyscalculia. So dyspraxia is with the movements, with anything like the child who is not able to copy the PT instructor. And then dyslexia is mostly having the problem in academics, and dyscalculia is mostly having problem in calculations. So this 3Ds has to be assessed, like which D is missing in a child. So once we assess the child, and then we start with the treatment, like what is, like suppose if a child is having a problem in writing, so that means when we write a S, so that means what we do is like we have this finger identification and finger localization, what we call it in our terms. So that means even like the finger which is moving like this, like we are patterning the same system in our brain also. So this is how, suppose the child is having problem with S, probably within writing, what is the typical problems are? The writing with P and D, or it's P or Q, or it's the small letters B and D are always been like they have a spelling mistake. So what we do is, and a part of the therapeutic thing is like same, we do the brain mapping part of the thing. So what we do is we use SANS or something like that, so that this thing gets a patterning in our brain, so that it's when it's represented in a 2-dimension on a paper, so that is easy for them. So every child, like suppose like when we treat with autism child, autism again what sir said was like diagnosis in three areas, which is the behavior part, which is the sensory part, and the communication part. So we check it like in the gold standard methods or whatever is that. So every 3 things we just check it out with that which part is less. So which part is missing out, the communication part, or the behavior part, or the sensory part. So whichever the thing is less, we start treatment with that particular area.
What do you think are the early signs that teachers and parents should look out for? Since it is, let's say, an uncharted domain, generations before this were very unaware of the existence of